Good afternoon, everybody. We are going to get started. Thank you for joining us today, and a big thank you to our speaker, Dr. Bronwyn McBride. Bronwyn's a postdoctoral fellow at Simon Fraser University and a research associate at the Center for Gender and Sexual Health Equity. She completed her PhD with the center in July 2020 with the support from a CIHR doctoral award. Her PhD project aimed to evaluate the impact of Canadian in-demand sex work laws and immigration policies on labor conditions among indoor and immigrant sex workers in Vancouver. Bronwyn has presented her research at several international academic conferences, including the 22nd International AIDS Conference in Amsterdam, supported by a full AIDS scholarship and a CIHR travel award, and the Law and Society Association Conference in Washington, D.C. She is a committed advocate for sex workers' rights, and we are very lucky to have her with us today. Welcome, Bronwyn.
Thank you so much for the warm welcome. I'm excited to be here. Shall I begin screen sharing?
Yes, please go ahead, and I will just put out a reminder to everybody that we do record these sessions, but we record them in a way that keeps everybody anonymous, and we don't share the questions and answers after the presentation is over. Go ahead.
Sounds great, thank you. All right. Hi, everyone, and thank you so much for attending my presentation today. I'm assuming everyone can hear okay?
We can.
Perfect. So my name is Bronwyn. I'm a postdoctoral fellow at the Center for Gender and Sexual Health Equity, and I'll be speaking more on my postdoctoral research during this presentation. Thank you so much for having me. So I'd first like to acknowledge that our work, my research work, takes place on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and that I'm a settler here. The ongoing effects of colonialism deeply impact the labor conditions and human rights of Indigenous sex workers in Vancouver and across Canada, and our community-based research work really has a responsibility to acknowledge and address these colonial harms. So this is just an overview of my presentation today. I'll go through some background on sex work, different legislative approaches to sex work, and the current legal framework in Canada. Then I'll discuss some occupational health and labor rights issues faced by sex workers, and close with some recommendations and areas for discussion. I'd also like to provide a caveat and say that I am not a labor studies or occupational health scholar, and my expertise in the field of OHS is very limited. My doctoral research focused explicitly on how shifting criminalization of sex work in Canada affected sex work environments, and I applied this labor orientation just because insufficient research has examined sex work from a labor lens. It's important to begin by defining sex work. The WHO defines sex work as the provision of sexual services for money or goods. In New Zealand, where there are no criminal laws pertaining to sex work is defined as the exchange of sexual services, performances, or products for material compensation. Critically, sex work represents consensual exchange of sex services, whereas sex trafficking is defined by forced sexual labor. Consent is central to sex work and is what separates sex work from exploitation. Phone sex operation, exotic dancing, webcam modeling, porn film performing, and others are also forms of sex work, and these all have varying work environments, levels of physical client contact, levels of HIV/STI exposure, and very different occupational health concerns and risks. Most research in the public health disciplines has focused on full service sex work, so the exchange of in-person sex services in settings like parks, cars, apartments, supportive housing, massage parlors, and escort agencies. Full service sex work has the greatest implications for HIV exposure, and as a result, that's where most research has focused and what I'll be presenting on today, but it's really important to remember that these other forms of sex work exist. And further, if we consider sex work from an occupational health and safety perspective, there's a lot more to think about beyond HIV and STIs. Globally, sex workers face unacceptable health and labor rights inequities, and these stem largely from criminalization and stigma. Criminalization restricts safer ways of working, such as working with others and in managed indoor venues, and also shapes regressive policing, which increases workers' risk of violence and barriers to occupational health. The occupational issues that sex workers face, such as poor working conditions and lack of recourse in situations of exploitation, are very similar to those faced by other precarious and informal workers. Sex workers don't enjoy the same labor protections as most workers do because sex work isn't legally governed as a form of labor, but rather as a form of gender-based violence. Sex work is treated as a moral issue instead of as a type of work. This has severe implications for workers' occupational conditions. So there are three main legislative approaches to sex work. Under criminalization approaches, all or some aspects of sexual labor exchange are criminalized, such as purchasing sex services, soliciting sex services, or acting as a third party in the exchange of sex services. Under legalization approaches, there are regulations on where and how sex work is allowed to take place. So these can include zoning, licensing, registration, requirements, or mandatory HIV/STI testing. Decriminalization refers to the removal of all criminal laws related to sex work, under which sex workers are just treated as independent workers who can work with other people and organize their labor how they see fit. A new type of sex work criminalization called in-demand legislation has been implemented in dozens of countries over the past 2 decades. In-demand laws leave the sale of sex legal, but they view sex work clients and third parties, such as venue managers, venue owners, security, and others, as exploiters. As a result, in-demand laws criminalize clients and third parties in an effort to end the demand for purchasing sex services. So a bit on the Canadian context, in 2013, Canada's sex work laws were struck down by the Supreme Court as unconstitutional for violating sex workers' rights. Chief Justice McLaughlin said, "The prohibitions heighten the risks the applicants face in prostitution, itself a legal activity. They do not merely impose conditions on how prostitutes operate. They go a critical step further. By imposing dangerous conditions on prostitution, they prevent people engaged in a risky but legal activity from taking steps to protect themselves." This quote emphasized that selling sex services is legal and that the previous laws infringed on sex workers' ability to keep themselves safe at work. The Supreme Court also highlighted indoor venues such as massage parlors as safer places to work. However, 1 year after these original laws were struck down, new in-demand legislation called the Protection of Communities and Exploited Persons Act was passed in 2014. This law criminalized the purchase of sex services for the first time in Canadian history. The law also criminalizes third parties, such as venue owners and managers, under the assumption that they exploit sex workers. So Canadian in-demand legislation ostensibly aims to lift the burden of criminalization from sex workers and makes the sale of sex legal among Canadian citizens. However, under immigration policies, selling sex services remains criminalized among temporary residents and open work permit holders. Further, sex workers who hold third-party roles, such as also being a venue manager or a venue owner, are also criminalized. So in this context, immigrant and indoor sex workers may be further marginalized by legislation that is purportedly designed to protect them. Further, in-demand laws are likely to reproduce the same unconstitutional labor conditions that sex workers faced under the previous laws. Since 2014 in Canada, news reports suggest that police raids of sex work venues are increasing, particularly in venues owned or staffed by racialized immigrants. These raids have resulted in charges and deportations of immigrant sex workers, underscoring a need for further empirical research on the impacts of law reforms on sex workers' labor conditions. My doctoral research drew on data from the Aisha project. Aisha involves a community-based cohort of over 900 sex workers working in diverse locations across Vancouver. Since the study's inception in 2010, current and former sex workers have been hired throughout the project, including as interviewers, nurses, and study coordinators. Aisha also includes a qualitative component, wherein sex workers and third parties are invited through Aisha outreach to sex work venues across Vancouver, including outdoor spaces, and participate in in-depth interviews that are conducted by multilingual staff. So it's time for our first poll. Many of us have experienced working alone for the first time during the recent lockdown period over the COVID-19 pandemic. For you personally, which way of working best supports your physical and psychological health? I'll give you a few seconds to fill this poll. It's really cool. So this is a really interesting outcome. As we see, different things work for different people, and it's important that people are able to work in ways that support their choice and their physical and mental health. Okay, I'm going to move on to the next poll question. If we can do that. So new Canadian end-demand laws explicitly aim to protect sex workers and make them safer. With this in mind, do you think the laws support sex workers in working together in indoor workspaces?
We've got about 45 people online, so I'll just wait until most of the answers are in.
Sure. This is great. How cool. So 68% think that the Canadian end-demand laws do not support people working together in indoor workspaces. And you are right. So that will lead us into our first discussion of occupational health issues in sex work. So we can just minimize the poll. I don't know if it's possible, but.
It should be gone.
Oh, okay, I don't know why. It's still on my screen, but.
You can probably close it yourself.
Oh, that's true, I can. Great, perfect. Okay, so the first occupational issue in sex work is really the criminalization of third parties and clients. Similarly to the previous legislation, end-demand laws continue to criminalize all third parties who gain material benefits from others' sex work. And if the material benefits are gained in the context of a formal indoor sex work venue, like a massage parlor, this is considered an aggravated offense. So if you think about this, this effectively renders all organized indoor workspaces illegal to operate under Canadian end-demand laws. The purported aim of this law is to protect sex workers against exploitation. However, considerable evidence from the Canadian context and globally illustrates that indoor venues with supportive management are among the safest sex work environments. Second is client criminalization. So the new laws criminalize the purchase of sex in an effort to disempower clients. However, if you think about this, client criminalization can actually shift the power dynamic in favor of the client because now they risk the most in the transaction. Clients can insist on meeting in isolated or unsafe spaces or in their homes if they want to protect themselves from police, and sex workers have to meet clients' demands if they want to work. So, oh, looks like I'm Great. So, sorry. So, stereotypes of third parties in sex work as coercive male pimps really inform the criminalization of third party involvement. And I'm sure that everyone listening has heard of stereotypes about these type of people in sex work. However, there's considerable evidence from diverse global settings that suggests that most third parties in sex work are actually women and often current or former sex workers themselves. I chose to do a study involving only third parties in sex work to explore how criminalization shaped their ability to provide supportive services to sex workers. Among 25 third parties, we found that the majority were women and 2/3 were actually current sex workers. Others had retired from sex work and shifted into managerial roles, very similarly to career trajectories, which you see in other industries. This evidence is really important because it demonstrates contexts of collective support and cooperative, collaborative work among women sex workers, which really problematizes assumptions of male pimps upon which third-party criminalization is based. In a study that we did examining the correlates of sex workers' engagement with third parties, we found that use of third-party services, so managerial or administrative or security services, was independently associated with increased access to condom distribution and to community-led services such as sex worker drop-in spaces. However, sex workers' access to third parties was decreased after end demand law reform. So it's time for another poll. If armed policemen routinely showed up unannounced to inspect your workplace and ask you questions, would this make you feel safer at work or less safe at work? It's really interesting to have this data gathering during the presentation. It's really cool.
Looks like we have fairly universal agreement on this.
Right. So in general, your well-being and safety at work might be negatively affected if police were constantly showing up. Great. Okay, I'm going to move forward. Oops. So the next occupational issue in sex work, as you might have guessed, is punitive policing. So in criminalized contexts, police must routinely surveil, visit, and raid indoor sex work spaces to enforce the law. This punitive policing and harassment undermines sex workers' labor conditions. So punitive policing has been documented to drive sex workers into more isolated spaces where they face greater vulnerability to violence. In Vancouver, sex workers who fear police visits have reported moving away from safer workspaces such as massage parlors into isolated apartments where they may be safer from police, but they can be more easily targeted by perpetrators. Policing also frightens clients away, which disrupts income security and has been linked with increased barriers to accessing health services. So these are some quotes from from third parties and sex workers on their interactions with police. So this woman, who is a venue manager and former sex worker, said, "Police made us nervous when they were here. The girls felt uncomfortable. They didn't act impolitely, but made us feel something happened, so they're here." The workers' concept is police only show up when something happens. When they were here for no reason, the girls felt unsettled and had a sense of fear. This next quote talks about a gross violation of privacy that one woman experienced at the hand of police. So she said, "One time I got ID checked by police in a place I worked. Then after a couple weeks, I was driving with a speeding problem and I got pulled over and the cop were threatening me about, 'Oh, you work in a massage parlor.' At that time, I had my close friend with me and I felt really embarrassed." And I think that's a really bad thing cops do because it's the record that I worked in a massage parlor and it shows on the driver's license. And he used that to, he humiliated me. So these quotes highlight how even friendly police visits can be experienced as stigmatizing or threatening to sex workers. and how police can abuse their power and authority over sex workers in ways that violate their privacy and undermine their rights. Another poll question. So Canadian and demand laws, as we've said, purportedly aim to protect sex workers and make them safer. With this in mind, do you think indoor sex workers feel comfortable in keeping PPE such as condoms and lubes on site? So almost 50-50 here. This is really great. So while having condoms is not explicitly illegal, it can be used as evidence of criminal sex work. So that is what I'm going to go into in our next slide. So the next occupational issue is PPE and sexual health access. Condoms are PPE for sex workers, and access to condoms, lubricants, and voluntary sexual health testing are really critical occupational health and safety supports. However, police in diverse countries have been documented to search sex workers and workplaces for condoms as evidence of criminal sex work, which discourages sex workers from carrying them and using them. In Vancouver, it's been documented in a couple of different studies that police use condoms as evidence for sex work. This has resulted in venue managers limiting workers' access to condoms and prohibiting delivery of condoms, lube, and free sexual health testing by outreach workers. This evidence clearly highlights how the criminalization of sex work undermines workers' access to essential PPE. So supportive sex work managers will promote access to PPE and sexual health. This woman, who is a sex worker and also a venue owner and manager, said, "I always tell them, like, everything you do with a condom. It's like protection is the first thing. It's for your safety, your personal safety health concerns, right? So I always have condoms in the shop, and KY as well." However, criminalization of third parties and use of condoms as evidence results in managers hiding and restricting condoms, for example, by locking them in a storage cupboard. This venue owner and manager said, "You can be charged if police find condoms. The shop would get charged. So I can't have condoms in here. I do, and you know, and they're under lock and key." So this really demonstrates how, because of third parties being criminalized, basically massage parlors that offer sexual services have to pretend that they don't in case police come by, which means that they really can't have condoms around. So it's time for, I think this is the final poll question. This one's a little self-explanatory, but if you worked at a retail store and were threatened by a client with a gun who physically assaulted you before robbing your store, would you call the police to get assistance or to report the crime? So most of us would feel comfortable in calling the police to report a crime. Some people did say no, and I'd be really interested in hearing, what are the different reasons that make people hesitant to call police for support? And I think this is actually a really important discussion. Maybe we'll have it at the end. But for now, the final occupational health issue in sex work that I'm going to discuss today is workplace violence and lack of recourse. So the legal status of sex work shapes both prevalence of reporting violence, workplace violence, and workers' ability to access legal protections. Human rights violations against sex workers have been documented to be most profound where aspects of sex work are criminalized, because sex workers fear reporting violence to police because they fear getting criminal charges. Violence is also really fueled by perpetrators' recognition of sex workers' devalued social status and lack of labor protections. Sex workers' inability to contact police for support enables violent aggressors to abuse sex workers with impunity, which perpetuates high rates of workplace violence. Criminalization can also enable police violence against sex workers, such as harassment, physical and sexual assault, or forced sex under the threat of arrest, which has been documented globally and is obviously a clear obstacle to sex workers' access to recourse. Finally, and I think this is really important, especially for this group, criminalization of sex work inhibits the development of policy and program alternatives aimed at addressing and reducing workplace risks, as are standard in other industries. So for example, taxi drivers, convenience store owners, and construction workers all face violence or safety risks on the job, but we don't respond by making those industries illegal. We work with the industries to develop interventions and guidelines to protect workers' rights. So we conducted a study to examine prevalence of reporting violence to police among sex workers in Vancouver. And we found a significant burden of unreported violence, particularly among immigrant sex workers, among whom 87% of violent incidents experienced between 2010 and 2017 were not reported. Further, in a time series analysis, we found no significant change in level or trend of reporting violence before and after end-demand law reform. So this suggests that under the new laws, there has been no improvement in sex workers' access to police protections, which is really an unacceptable outcome of this law. In multivariable confounder models from the same study, immigrant status and working in a formal indoor venue like a massage parlor relative to outdoors were associated with decreased odds of reporting violence. Emerging evidence from both Canada and other contexts has shown that the ongoing criminalization of sex work under end-demand laws is continuing to undermine sex workers' safety and access to police protections. So this sex worker and venue owner manager said, "I heard a girl was battered all black and blue, but she didn't dare call the police. They were robbed. Those men are smart. They know the transaction is by cash. He pretended to be a customer and saw there were only 1 or 2 girls working whom he can handle, so he beats you up. And you don't have status. As long as it's not life-threatening, they don't dare to call police." This venue owner and manager reported 2 massage parlors down on X Street, as far as I know, did not phone the police when they were robbed at gunpoint. That is how fearful some people are, because technically what they're doing is against the law, so why bother phoning the police? So the key findings and takeaways from this research are that criminalization really expectedly undermines sex workers' ability to work safely, and that end-demand legislation in Canada is reproducing the unsafe and unconstitutional occupational conditions of the previous legislation. This research informs 4 evidence-based recommendations at federal law and policy, law enforcement, and regional and municipal occupational policy levels. There's a need to fully decriminalize sex work, including among immigrants, to enable sex workers the same labor and legal protections extended to other workers. There's a need to decriminalize third parties in order to promote safer indoor workplaces where management are supported in promoting PPE use and sexual health among workers. There's also a need to sensitize authorities towards addressing punitive and discriminatory policing. And finally, there's a need to develop municipal workplace standards through the OHS regulation and Employment Standards Act to ensure basic standards of compensation and conditions, safety and fair treatment for employees and employers, and mechanisms for recourse in case of workplace violence. Further, it's imperative that sex workers are involved in the design, implementation, and evaluation of all programmatic and policy interventions that have the potential to affect their labor environments. Thank you all so much for attending this presentation today. And if you take away one thing, please remember that sex work is real work and that all workers have the right to healthy and safe working conditions. If you have any questions, please feel free to email me. And otherwise, I think we're going to open it up for discussion. Thank you so much.